Hello, thank you so much for joining us for our third session of the Children's Environmental Health Center Virtual Symposium series on heat, impacts on children in pregnancy. The Children's Environmental Health Center is within California EPA, housed in the Office of Environmental Health Hazard Assessment. And our goal is to really incorporate children and pregnant people into all of the work that Cal EPA does. If you missed them, our first two sessions happened in April. Session 1 was on pediatrics, physiology, and the epidemiology of heat illness. And session 2 was on pregnancy, physiology, and the epidemiology of heat illness in pregnant people as well. Today's session is going to be on strategies for responding to heat. And then the fourth session, which is upcoming, will be on heat action plans and heat health warning systems, and what the important considerations are for those regarding children and pregnant people. Our agenda for today is here. We've got some really excellent experts in the field here to talk with us today. Really happy to have them joining us. I'll introduce each of them as we come to them. As we've done for our prior sessions, each of our speakers is giving a short talk, and then we will open it up for a longer, more interactive discussion section at the end. If you have clarifying questions, please feel free to put those in the chat. We may take a clarifying question or two immediately following the talks. Otherwise, other questions will be incorporated into the discussion panel later. And so you're welcome to enter those questions in the chat as we go. You can also raise your hand during the discussion panel. I'm really happy to make this a more interactive session.
I'd like to introduce our first speaker, which is Kristie Ebi. Dr. Ebi is a professor in the Center for Health and the Global Environment at the University of Washington. She has an MS in toxicology from MIT, a PhD and Master of Public Health in epidemiology from the University of Michigan, and did 2 years of postgraduate research at the London School of Hygiene and Tropical Medicine. She's been conducting research and practice on the health risks of climate variability and change for over 25 years. And we're really thrilled to have her here with us today. She's quite an expert in this area. Thank you so much, Kristie. And I'll just note for the recording that we missed a very small chunk right as Kristie started. She thanked us for the opportunity to participate and then got into her talk. You didn't miss anything else.
And we'll start with, I know you had a session on physiology, but just to remind people that heat affects our bodies. Our bodies have ways to try and deal with excess heat. We also have behavioral mechanisms. When it's too hot, people go outside, for example, go to the shade. They try to find someplace cool to be. In a house, you'll go, if you have a basement, you'll go into the basement. And then physiologically, our bodies have a range of responses up to and including sweating to try and decrease our core body temperature. Our core body temperature needs to stay within a fairly narrow range to protect our cells and our organs. And when those mechanisms, behavioral and physiological, are insufficient to the rise in core body temperature, then we start seeing effects on our organ systems. You can see the heart is highlighted here on the right. And that's because when one does excess mortality calculations after an excess heat event, about half of all the deaths are from cardiovascular causes. People, for example, who die from a heart attack who wouldn't have had a heart attack otherwise. And it's important to keep that context into account. In terms of how heat affects pregnant people, there's a lot of research area. There's more that needs to be understood. For children, again, there's a lot more that needs to be understood. They're less well able to handle the heat in many instances. It depends on the age. And so need to make sure that they're protected when temperatures go up. There's a wide range of heat illnesses. It falls across the spectrum, starting from heat rash, for example, all the way through to heat stroke. Heat stroke is a medical emergency with high mortality rates. Very important to get people's core body temperatures down to protect against heat stroke. And on the right, you can see a whole range of changes and syndromes that are associated with exposure to high ambient temperature. Clearly an issue where there needs to be more effort to increase awareness so people understand the challenges of being exposed to high ambient temperatures, and then to increase the attention of our public health systems and, frankly, of our design for urban areas to make sure that we take into account rising temperatures as the climate continues to change. Exposure is going up. This is not specific to pregnant people, but you can see from the Lancet countdown, exposures from 1980 for adults over the age of 65 and children under the age of 1. Very clear pattern. And as temperatures continue to rise, that's only going to increase. You can see the very large numbers. Worldwide, for children under the age of 1, in 2020, there was more than 325 million more person days of exposure. Clearly an issue that's going to be with us for quite some time. I put these slides in here because if you're not aware, there's a new product from Climate Central. It's called the Climate Shift Index. And you can go, it goes back to 1980, and you can look for today, whether the temperature today is about what it should be for the long-term average, or if it's much higher than the long-term average. And this gives fingerprints of climate change. And these are the summary data for summer days in 2022. This focuses on days, but what we know is really important from the health perspective are the nighttime lows, that when the day temperature is quite high and the nighttime low doesn't fall back to where it did historically, it doesn't fall back to a temperature that helps our bodies cool down at night. It significantly increases the heat stress for everybody. Of concern, of course, in this session is around children and pregnant people. You can go find these under Climate Central. As I said, they publish it every day. The focus of the research has been on temperature. But a paper published just a couple of days ago that Jenni and I were involved in looks at moist heat stress. So it looks at the combination of temperature and humidity. This is a projection out towards the end of the century, showing that when one looks at the heat stress from exposure to the combination of high temperature, high humidity, that in the future, that humidity, and it's specific humidity, not relative humidity, is going to be critically important for looking at heat stress. And this is another space where the focus in the epidemiology literature has been on temperature alone, sometimes on apparent temperature, which is one metric for combining temperature and humidity, but better understanding, particularly in temperate regions such as the United States, not all of the United States, as Jenni will remind us, but as we think across much of the United States, of better understanding this combination and how much that increase in humidity is affecting adverse health outcomes. It's not just the temperature and not just the humidity. There's a whole range of other issues that affect the association between extreme heat and the risk of preterm birth. There are increasing numbers of publications showing that exposure to high temperature during the last trimester of pregnancy increases the risk of preterm birth. Babies come earlier and then they are typically smaller. So there's more small birth weight babies, low birth weight babies. And this just shows from a relatively recent study that these increases are fairly significant for an adverse pregnancy outcome. And there needs to be more effort to communicate this to healthcare professionals, to pregnant people themselves, and to the people around them to make sure that they protect themselves during episodes of extreme heat. In terms of some of the strategies, we need to think about the wide range of factors that increase or decrease vulnerability. What makes a difference in terms of the exposure that a person experiences and the environment in which they are that are affected by the social determinants of health? For example, in the US, we know that red line districts are hotter than surrounding areas. Part of the process of redlining meant that red line districts have fewer trees planted, and so they're hotter. They also tend to be food deserts. And so you see a combination of places that are hotter than the rest of the urban environment, have lower access to high quality food, and therefore have a higher risk of chronic diseases, diabetes, heart disease in these areas, which put people at higher risk of adverse outcomes during heat events. And finding ways then to intervene on the exposure and to intervene on the causal pathway to reduce the overall vulnerability. One of the main approaches for doing so are heat wave early warning systems, and I understand you'll talk about these in more detail in a subsequent session. And this is a nice little graphic showing you the benefits of having heat wave early warning and response systems. It's not just the warning, of having the response. And you can think about using various messaging within these systems to reduce exposure. For example, the example on this was air conditioning, but there's lots of ways to keep oneself cool without air conditioning, preventing the onset of illness, and then increasing access to care once people do have symptoms. Heat wave early warning systems are not necessarily expensive to put together. They do require quite a lot of coordination. This is part of the heat wave plan for England. And I'm not going to go through this. I just put this in here to show that there are a broad range of different actors, different organizations that need to be involved. We need to think about people who represent the unhoused, people who represent red line districts, and making sure that those who are most affected are represented when putting together these alert systems. Need to think about, for example, the nurseries and kindergarten when we're talking about children and how to protect them during high episodes of high temperature, and reaching out to the healthcare providers to make sure that pregnant people understand the risks and understand what they need to do and have access to the sources and resources they need to be able to take action. These graphics were put together for a heat and health series that appeared in the Lancet 2 years ago. The figure on the left shows sustainable and accessible ways to keep cool without using air conditioning. I'm delighted to say that the Lancet has published these in English, Spanish, and in Hindi, and there's work ongoing to publish in French as well. And they're quite happy for others to do the translation and to post these on their website. And these are quite helpful to think about how to make sure that people, as I said, have access to the sources that they need, and point out there's lots of ways to try and keep cool without having to have air conditioning. If there is access to air conditioning through, for example, libraries and others, one needs to think about all the steps for making sure that people know where the library is, how to get there, how long they're going to be open, what they would need to bring. Are they going to be provided water? Do they need to bring water? There's lots of operational questions that need to be sorted out, and they're really quite effective. The figure on the right then is thinking about the long-term planning to make our cities more sustainable. NOAA has put together a comprehensive awareness social media campaign around heat. It's through the National Integrated Heat Health Information System. There's also heat.gov, which is a great reference for looking at what can be done to help raise that awareness and make sure that people are ready to take action. This is obviously a few weeks old, but gives you a sense of the kinds of information that can be available and can be useful for all scales as people think about how to protect pregnant people and children this coming summer. And I wanted to end with a comment about investments in our health systems and investments in reducing greenhouse gas emissions. These are projected heat-related deaths to the end of the century. And these projections are useful because it looks at with and without adaptation and the extent to which we reduce greenhouse gas emissions collectively. If you compare the top left map, no adaptation, high emissions, the bottom right, adaptation, low emissions, those are very, very different worlds. And the choice of which world we're going to be in is up to us and up to our leaders to make sure that we invest in our health systems and in greenhouse gas emission reduction. And finally, heat is an all of society problem. And it's critically important to focus on what heat means for health and well-being, and also need to think about what it means for our animals, our pets, our livestock, what it means for crops, what it means for others, what it means in terms of exacerbating the risk of the wildfires that are blowing, the wildfire smoke blowing out of Canada right now and severely affecting the East Coast. And so thinking about heat in the broadest context will mean that we are more effective over time in increasing resilience. Thank you for listening, and I look forward to the other talks.
Thank you so much, Chris. I don't see any clarifying questions in the chat for now, so let's go ahead and move to Jenni Vanos. Jenni, you can go ahead and start sharing your screen while I introduce you. So Jenni is an associate professor in the School of Sustainability at Arizona State University. She completed her PhD in 2012 at the University of Guelph in Canada and her postdoctoral degree with Health Canada. She focuses on extreme heat, thermal comfort, and air pollution in her research, and examines health impacts on vulnerable populations, including children and athletes. So she's currently running numerous field projects in Arizona and collaborates with a whole bunch of folks in community-based research about heat. And so we're really excited to have her sharing some of that knowledge today. Thanks so much, Jenni.
You're muted, Jenni. All right, thank you. Okay, so I'll start over. So thanks, Stephanie, for that great introduction. I'm excited to be here, and I'm going to zoom in to schools and playgrounds and really think about what are the strategies that we can implement depending wherever in the country we are, and specifically thinking about some of the climate that California deals with to decrease the health effects of heat. And then also thinking about adaptation or adaptive capacity and increasing that in schools. Collaborators and funders can't do any of this without working with people like students and teachers, community members. We work really closely with cities here in Tempe, Phoenix, Mesa, and so forth in the Valley. I've worked with schools in California as well, and then just a lot of support from the US and Canada for some of the projects I'll be talking about. So I'm going to go through some of the problems and motivation why this is an important problem and challenge to solve, the research and engagement, some of what we're doing here in the Phoenix region, and then getting into more of the solutions-based strategies and where policy might be able to play a role. So when we think about problems within warm weather play, I'm going to go through playgrounds and schoolyards are hot. They get hotter depending on how they're designed. When we're thinking about the warm seasons, depending on where you are, the shoulder seasons here in Phoenix are still very hot. And then in some locations, it might just be certain months of the year that are of a concern with playgrounds increasing their temperatures. Kids are vulnerable. We know that. I'm not going to go too much into that because some of the previous talks delved into the physiological vulnerabilities. And then oftentimes the designs that are put in place lack the solutions for heat safety. And so heat is often not seen as a safety factor in playgrounds, and I'll go through that. So together, these decrease play, especially safe play in spaces that are designed for play. So what can we do about it? But getting into a little bit more about heat risks, and when I say school children, I just mean youth, children who would be generally in elementary school using these playgrounds, whether public playgrounds or school playgrounds. But the behavioral factors are really important to think about with respect to children's vulnerability to heat, and understanding what they've experienced, what different strategies are they going to implement to decrease their exposure to heat or to deal with that heat as a stressor. And some kids know what to do, or they'll automatically seek shade, or there's water fountains available outside. And then in some locations that's not available, they don't know what to do. And the younger they are, they might not know what they're starting to experience. So teaching kids about the signs of heat illness, and no matter what their age, is really important. Bringing water along. There's so many little strategies depending on the age of a child that we can start to implement. And I think a lot of parents already do implement, but at the school level, it can be quite hard to deal with a lot of kids. So we often forget about those behavioral factors, and just acknowledging that kids don't have that experience yet to know what to do, to change their clothing and whatnot. We know it also affects their behavior in the classroom if they've been overexposed to heat, their ability to play, and then it can negatively affect their learning. And indoor and outdoor heat is a concern, and depending on where in the country you are, there might be rules around what level of indoor air temperature can be inside of a school. So here in at least Maricopa County, you have to keep schools around 80 degrees Fahrenheit or so, but in other areas of the country that might not be a rule. So we have to remember that as well, especially globally. And then some of our motivation too is acknowledging that there's a lot of heat-related illness emergency department visits among children in Arizona, and seeing at what times of year do those frequently occur, and then also taking into account the fact that schools are changing, here at least changing their schedules, and some elementary schools in Tempe are going back mid-July this year, which is going to increase their heat exposure or just decrease the amount of play they can get throughout the day. So we're even working with teachers to figure out how we can do more indoor play when a gymnasium isn't available. So benefits of play, kids gain a lot of their activity at school or childcare centers. And it's so vital to a child's development that it's included in the UN Convention on the Rights of the Child. So if we think about any concerns like unsafe conditions, extreme heat, sunlight, or chemicals in the environment that can hinder a child's health, that is a big concern to the rights of a child and their development. So how I like to focus on this is how can we create spaces that are environmentally safe, thermally comfortable, and conducive to active play for longer periods of time throughout the year. So I'm not saying send the kids inside when it's hot. I'm saying, how can we better design our spaces so that when it is warm and a little bit hot, we can make sure they can play safely, or can we change the schedules? But when it is too hot, we do have to have ways to keep them engaged and active, and not overexposed to heat. So it's thinking really proactively about this and being prepared for those times. And I'll go through some of those strategies. But with respect to those high playground temperatures, we know that surface temperatures in contemporary playgrounds can get very hot, and that can burn a child's skin. These are images taken in Phoenix. The air temperature was about 100 degrees Fahrenheit, which isn't anything too unusual here. And you see surface temperatures up to 176 on the rubber surface there, and 160 on the slide surfaces. Anything darker, like the blue and green in that picture, is shaded. So shade plays a really important role in keeping surface temperatures down. UV exposure and sunburns go hand in hand with this, and we know that that's linked to child skin or adult skin cancer, and a lot of playgrounds lack adequate shade. So you might see playgrounds like this. This is in California and San Diego, where there's a tiny bit of shade, and that's only going to provide shade at the certain sun angles, and that might be meeting certain shading percentage requirements, but it's not really doing anything to increase the usability of that playground in a hot climate. And you see artificial turf is used, and then hot asphalt around it. And so to me, that's a playground that wasn't designed with the climate in mind. And what can we do about that so that we're not overexposing kids to high surface temperatures that can result in burns, second or third degree burns to the skin that can send kids to the emergency room. And I know that's a hard picture to look at, but it happens. That's in New York. So this can happen anywhere in the country where we see a lot of sun intensity on these hot surfaces that can heat up throughout the day and conduct a lot of heat towards the skin. And in 3 seconds, the surface 60 degrees Celsius, which you saw in the last slide, can burn a child's skin, second degree burn. So how are we thinking about this from the injury prevention framework? So this is our National Program for Playground Safety, really great collaborators of mine, and they think about maintenance and supervision and fall surfaces in appropriate environments, but not until they met me did they start thinking about what is the role of extreme heat and overexposure to sunlight in appropriate environments. So we're trying to understand how that's included in playground design and understanding safety for a playground. So we worked with Health Canada a couple years ago to create a full survey of experts and then an annex into their Standard Councils of Canada that incorporates thermal comfort from both heat and cold standpoints into the design of playgrounds in Canada. And we did an international survey, about 80 experts across designers, urban planners, landscape architects, public health, researchers, to understand what's being prioritized and what they think should be prioritized in playground design when we think about some of the environmental components. Sun exposure on or near the equipment or surfacing materials and temperature of equipment were very highly ranked in what should be prioritized. And then we also see that when we talk about shade from trees, structures, or buildings, all very important types of shade, they have not been prioritized, but over 70% think that they should have priority in the way playgrounds are designed. And then we had a lot of nice feedback around how to incorporate shade, because you can't put it everywhere. It is expensive. There are restrictions to where you can put it and when, and how to maintain it. So we can invest in places where shade where activity happens. That's really important. And we can incorporate, and designers do this, with trees and shade sails. Where will the sun be the most intense at what time of the day? And then understanding thermal comfort, it has not been prioritized, and a lot would like to see it more prioritized. So we can kind of see too, natural shade is stated as requiring the most priority in playgrounds, yet it hasn't been too prioritized in the past. So we get a lot of these quotes from some teachers here around staff members experience dizziness, heat exhaustion during the month, headache, nausea from kids following outdoor recess. We talked to nurses about this too, and we hear it's too hot to play, and after they go outside, they're wilted flowers. So what can we do about this? We also get questions to the health department, the Arizona Health Department, from schools. Should we keep the students indoors for recess? Is it safe to go outside? Should my child's school allow her to go outside today? So they are requesting more guidance. And in one of our studies, we looked into, are you aware of the heat safety school resources? Did you know you can sign up for school heat alerts? And is this something you might be interested in? And so that gave us a sense for what schools are aware of and using, and a lot are looking for more resources to help their decision-making at the school level for heat preparedness. So a couple years ago, one of my students, Dora Shortridge, did a master's thesis and created the Heat Ready Schools rubric, where we worked with created 5 action areas from literature developed in Australia, actually. And we worked with schools in South Phoenix, and we looked at training and education, prevention, school policy, community, and environment. And we define heat ready schools as those that are increasingly able to identify, prepare for, mitigate, track, and respond to the negative impacts of schoolyard heat. So I'm not saying only put in trees and shade and you've solved your problem. I'm saying there's a lot more to it to prepare for and be able to identify it. So we did first interviews and qualitative data analysis plus literature review to create a Delphi survey that had 3 rounds of anonymous responses, where we asked participants to rank over 30 recommendations that what would be a heat ready school in those 5 different categories for validity, feasibility, and clarity. After 3 rounds, we ended up with a total of 30 statements that had high enough, so 7 or above ranks of validity, feasibility, and clarity, to create a Heat Ready Schools rubric and growth tool that had those 30 recommendations. The publication is shown right here. It's open access, so feel free to go check it out. And here's just an example of what it would look like from a school policy perspective. And the bolded ones are areas that we think are a little bit more weighty in how it can make an impact on heat readiness. For example, having access to a health professional such as a nurse or aide is not something that's fully common here. Some schools don't have that or only have it a couple days a week. So how can we make sure schools get that? How can we work with the Arizona Department of Health to get schools what they need there? That's really important to be able to manage extreme heat illness throughout the day. And then having training so that the teachers and staff can pay attention to that, or that they have a response plan for hot days. So we would work with them throughout all of this if they are one of our heat ready schools. We also have the environment, thinking about shade. We would help them with that. Cooling zones, water bottles, encouraging water drinking, training recess monitoring staff on heat illness protection, prevention, and response. We use existing training, or we create our own training with our program to share with them. We also create these posters that they put up in their schools where they can identify what they're doing to be heat ready and what they can still focus on that's low-hanging fruit or harder, and they might need to work on for a few years to try and start hitting more of the recommendations if possible. So these posters are put up either by the nurse's office or the front entrance so students and parents and teachers can see. So we have a lot of support for this, a lot of Spanish and English documents that's shared. And we're trying to build the program. We're at about 35 schools now across the Valley, and are trying to create a community with toolkits, water bottles, misters, fans, umbrellas, and then finding resources for shade sails and trees and so forth. And then working with Arizona Department of Health on this managing extreme heat recommendations for schools that they developed a few years ago based on some of their research. So I just want to give a little bit of an example of one of our first heat ready schools was Paideia Academies in South Phoenix. We've been working with them for quite a long time, even before the heat ready program, to implement green space, bioswales, and other forms of design interventions that can decrease exposure to heat and air pollution. So in 2020, their playground kind of looked like this, and we had COVID, of course, but then they still moved forward and planted a whole bunch more trees, added a lot of bioswales because they deal with a lot of flooding off a mountain in South Phoenix. You can't really see it in this drone image, but they added a bunch of hedges around that we're seeing grow really nicely, a really nice school garden. And so with that, what we're doing is tracking over time changes to the environment with a bunch of sensors and then some in situ monitoring that I'll give a quick example of here. We are really interested in the impact of sun on people's heat exposure. And the best way to monitor that is with assessments of mean radiant temperature and over the fine scale throughout the day. And so this is our mean radiant temperature chart that we measure short and long wave radiation in from 12 radiometers in the 3D space to be able to assess what are the different exposures to kids in different places of the playground. And so we've done 2 days so far in 2020 and then 2022. Remember, 2021 was when they did the redesign, so we couldn't do it that year. Some of our initial results look something like this, where you can kind of see anything with this little hat on it is shaded. And then otherwise it's not shaded, and we can start to see patterns with surface type and shading throughout the day. And schools want to know what's the coolest place that they can have an outdoor classroom in the day, or play sports in the day, and then how over time are the trees doing and the grass doing and the bioswales and so forth. And so we have done these assessments. This is just 1 day in 2020, so I'll go back. So 8, 10, 12, 2, 4, and then we've done that in 2022 as well, and we'll be doing it in a couple weeks again when we get the exact same weather day to start seeing those changes over time and then start seeing the impact of some of the design modifications. I know that was a lot there. With that, I'd be happy to answer questions later on mean radiant temperature and how we're assessing that over time. So some of my research takeaways then are thinking about heat mitigation going hand in hand with heat readiness, how we have to work with schools and within their systems. So what one school can do differs a lot from others, and to implement the heat ready program in another city or state would mean kind of redoing some of the surveys to make sure it's location specific. A lot of measurements like the mean radiant temperature are really important for decisions, evidence, and policy. And if we're just using air temperature alone, we're missing a really big piece of the puzzle when it comes to how to cool off places for kids. And there is a big need for better health data at the school level and at the child level. And then how can we pair that with congruently spaced environmental data? And then shade specifically is going to be the most impactful feature to lessen outdoor heat stress, whether that's from building shade, built shade from shade sails, or implementing more trees to provide shade in the right place. I do not support replacing shade with something like reflective coatings in playgrounds. That results in a higher mean radiant temperature in the daytime for kids. And we shouldn't be removing any kind of shade from playgrounds. And then if you have those reflective surfaces shaded, then there's no point in using the reflective coating. And happy to clarify that more as well. And finally, I just wanted to make everyone aware of this policy brief created by the UCLA Luskin Center for Innovation Policy on what California can do to improve extreme heat in K-12 education systems, the exposure outdoors, thinking about tracking the experience of extreme heat and cooling interventions that are used. I don't think there's a statewide indoor temperature limit for schools. And when I was in San Diego, I know a lot of schools didn't have air conditioning, and that resulted in cancellation of all of school on some heat days, which is a big problem. How can we mitigate heat exposure in schoolyards? Through evidence-based engineering and nature-based solutions. That means get the data, see what we're able to measure and changes over time. And then how can we manage that heat exposure through informed interventions? A lot of those interventions I mentioned in the Heat Ready Schools program. And then funding, how can we help find funding for schools that they can use for effective and targeted heat mitigation strategies in their school and schoolyard. So with that, I will thank you.
Thank you, Jenny. Really appreciate it. I'm going to go ahead and share Savannah's slides and welcome Savannah North. Savannah is the Director of Administration and Climate Initiatives with the Public Health Alliance. She has a degree in microbiology from UC Davis and got her, got her MPH in Socio-Medical Sciences from Columbia University. At the Public Health Alliance, she works on advancing community climate resilience and justice in partnership with a lot of local public health jurisdictions in Southern California, community-based and environmental justice organizations, and a variety of other partners. And Savannah has a lot of policy experience as well. Savannah, I am going to let you take it away.
Amazing. Thank you so much, Stephanie, and thanks to everyone for being here this afternoon. And as always, it's really wonderful to hear Chris and Jenny share about the incredible research and work that they're doing. So I'm really thrilled to be a part of this panel and share some of the work that we've been doing with our team and with our partners, and uplift one tool in particular, and a couple of other strategies that we're seeing employed at the local level to increase climate resilience to extreme heat, but to other impacts, and really thinking about it from an equity perspective, both among pregnant folks and infants and young children, but also among communities that are disproportionately impacted by other health and social and economic inequities. So next slide. Thanks, Stephanie. So very briefly, I'd just like to introduce the Public Health Alliance of Southern California. We are a coalition of the executive leadership of 11 local health jurisdictions, representing more than 60% of the state's population. And as Stephanie sort of mentioned, we focus on a variety of different areas, but all with the ultimate goal of increasing health equity, racial justice, and climate resilience. And as I said, I'll walk through a couple of different strategies and tools that our local health departments, as well as community-based partners and other agencies and stakeholders are using to sort of direct locally specific strategies, as well as local, regional, and state level policies to increase community resilience to extreme heats and climate change more broadly. So before diving into these specific strategies, I just want to share some of the broad framing that we approach this work with regarding the role of local health jurisdictions in advancing climate resilience at the regional, local, and often hyper-local level. Local health jurisdictions often have deep and really well-established relationships with communities in their jurisdictions, especially those that have been and continue to be disproportionately impacted by health and other inequities and climate impacts. And they have strategies for developing and providing culturally relevant messages and ongoing involving services and resources to residents. Moreover, they have access to local data regarding health status and emergent concerns, needs, and priorities, and existing planning and implementation mechanisms for really tailoring and changing services to meet those needs. Whether it's for pregnant folks and infants and young children, or other particularly vulnerable populations to the impacts of climate change. And as we see it and are kind of approaching this work at this time in particular, we see that really in the wake of the COVID pandemic and sort of the experience of local health jurisdictions, that they really are poised to be really proactive partners and leaders and in building community climate resilience to extreme heat. And I'm excited to share a little bit more about some of the strategies and how they're playing out at the local level with our partners. So I want to start with really beginning with kind of this exploration of data and strategies for translating data into action at the local level. As we all know, we want to inform any strategy or intervention with really robust data. So decades of research tells us that our life expectancy and well-being are tied to the community conditions in which we live. Which includes the existence of racially driven laws and policies. And this is particularly true for pregnant people and infants and families of color and low-income communities. And we know that access to social conditions that support health, or the social drivers or social determinants of health, like education, good job opportunities, healthy food, water, and air, vary drastically by neighborhood for a complexity of reasons. And it's for these reasons that we within the Alliance created the Healthy Places Index tool, which launched in 2018. And actually in April of last year, April 2022, we released our newest update to the tool, which is the HPI 3.0. And the HPI was expressly built to really highlight community assets and strengths using a positive frame that can be mobilized to implement solutions, including strategies for climate resilience. The HPI maps neighborhood level data on conditions that drive health, layered with racial justice data and resources. And again, these really community specific policy recommendations and intervention strategies related to advancing health equity and community climate resilience. So the HPI allows users to compare the health and well-being of communities, identify the community conditions that are shaping community vulnerability or resilience to different impacts, and ultimately support communities and leaders and different stakeholders and local agencies to turn these data into actionable solutions. Next slide. So with that kind of brief background on the California Healthy Places Index, I want to share a little bit more about this HPI that has been specifically designed around looking at extreme heat. So we in the Alliance were contracted by the UCLA Luskin Center for Innovation, which I'm sure many of you are very familiar with and may work closely with, to develop a spatial heat vulnerability tool, really designed for state and local agencies, community-based organizations, leaders, and many other users. And the intent of the tool was to visualize the distribution and impact of projected extreme heat at the census tract level across California, paired with measures of place and population-based vulnerability. And the core functions, again, in conceptualizing this tool, were including linkages to funding programs and opportunities. So again, that data into action focus, as well as a tool to identify the overlap of multiple vulnerabilities by place. Next slide, please. So this tool expands the original HPI's use by bringing in additional data layers to focus on the impacts of heat in California. And to reiterate, really provides a way for practitioners, planners, researchers, and residents to understand the community's vulnerability to future heat impacts, to then inform these actionable solutions and resources to build resilience. So in the extreme heat edition, it includes all of the data and the index within the HPI 3.0, that measure of community conditions, alongside measures of sensitive population and adaptive capacity indicators. And it also, again, provides that list of state resources and funding opportunities to really address extreme heat. Next slide, thanks. So what can, a user, an individual, an agency stakeholder do with the extreme heat edition? And I'm going to go through a couple of slides kind of showing this in action to give all of you a sense of what this looks like. But some of the core pieces are the ability to view projected extreme heat exposure and community resilience characteristics for neighborhoods across the state. And there are different sort of indicators for different projected extreme heat scenarios that can be toggled through depending on sort of the future scenario that the user's interested in looking at. There are the resources to address extreme heat. There's the functionality within the map to really filter layers within the map to display communities meeting specific criteria. So again, with a particular focus on like youth or, school-aged children, elder folks, those living alone, lots of different sort of like population-based or people-based characteristics that increase vulnerability or resilience during an extreme heat event. And there's also the functionality on being able to visualize multiple vulnerabilities to really find those places of intersection of the community conditions or the social determinants with the population sensitivity layers to really, again, hone in on specific strategies. Next slide, please. So as I said, I just want to show a few quick sort of demos on how someone would interact with this and what it would look like. So the first feature I want to share is accessing information about a community. So within the heat edition, you'll be able to see how a community compares to other California communities and view those factors that are shaping health and heat resilience in a specific neighborhood or project area. So local health jurisdictions can and are using this tool to look, again, really like neighborhood level, census tract level, to determine and shape sort of how they're providing services, communications, and other resources. There's also the ability to look sort of at school districts and things like that to guide resource allocation and sort of like programmatic strategies at the school level as well. So the climate and community details panel, and I think it should be live here. You might have to press play, Stephanie, thanks. Sorry, you're doing all the things here. So as you can see, when you click on a tract here, the climate and community details panel will pop up as soon as you click on the census tract level. And here we've selected a census tract in Fresno County. And you'll see the panel populates with the projected extreme heat days above 90 degrees, that's the default, as well as the HPI score for this community and the percentile it falls in statewide. Again, that measure of community conditions. And several groups of indicators that cover the projected extreme heat exposures, sensitive populations such as youth and young children, older adults, measures of health outcomes that are relevant. And then there are place-based indicators of neighborhood conditions like park access, pollution, housing stock. And then finally, this last panel here are detailed measures of race and ethnicity. Again, really approaching how we are looking at this data from both a race and place lens to inform strategies both at the policy and programmatic level. Next slide, please. So the other kind of key feature I want to highlight quickly here is the resources to address extreme heat function. So this allows users, again, to identify programs and funding opportunities to address extreme heat. And the resources are actually organized by potential recipient very, very intentionally here. So resources for the household level, workplace, schools, local governments, tribal governments, and nonprofits. Again, really using this as a tool to direct folks to resources and funding streams to support the strategies to increase resilience to extreme heat impacts. Perfect. So once again, just a quick little tour here. Thanks, Stephanie. So using the tools panel, again, here you can navigate to the resources to address extreme heat. And here there's, again, this list of resources organized by potential recipients, and the ability to then click into any of those resources to learn more about the program offerings, as well as getting to sort of the program homepage and contact to be able to sort of dive into that resource more. And on the next slide, perfect. This is the final demo, and then we'll share a bit more about some other strategies. But this is one of the features we're really very excited about that I've mentioned now around the ability to visualize multiple vulnerability indicators. So we really see this as one of the most powerful tools to support heat mitigation and adaptation planning. So here in our demo slide, again, we sort of navigate up here to the tools, and then you select the exposure indicator. So here we choose days over 100, and then you can select any other indicator. So for example, going into people and choosing youth populations age 5 to 14, and then we can collapse the people category and expand place. And maybe we're choosing tree canopy here. And then this is now creating this overlay of multiple factors that may contribute to, a neighborhood level heightened vulnerability to extreme heat. And so when you're hovering over the tracks here, you can actually see which indicators are in the most vulnerable quartile of their specific indicator. So the way we like to think about this is, for example, if a local health jurisdiction or a county level entity, is thinking about where to site a new neighborhood park or a parklet or other sort of strategies to decrease heat exposure, can use this overlaying of data to really guide that investment. And so we see this functionality in conjunction with really robust and intentional community co-development of strategies can be really informative in prioritizing specific neighborhoods and census tracts for different resilience efforts, sort of depending on the specific context of that neighborhood. So building upon that foundation of equity-oriented data tools that are very place-based, like the HPI Extreme Heat Edition, local health jurisdictions are very intentionally developing integrated climate and health plans to improve community climate resilience. And this is happening both in the Southern California region, but really across the state, and nationally, really seeing an increase in local health jurisdictions intentionally integrating climate change as a public health emergency and priority. So I've shared, this is just sort of the cover of the LA County Department of Public Health's recently released Climate Change and Health Equity report that really outlines their proposed strategies for action and their associated goals around building community climate resilience within LA County. So they're adopting a number of different strategies around internal capacity building, so really focusing on building the capacity of staff to engage in climate-related work with an increased focus on what they've kind of identified as climate critical programs like emergency preparedness and response, community and field services, vector management programs, those that they see were having a growing and sort of more urgent and emergent focus on climate-related issues. There's also a real focus on sort of this broader alignment with sustainability plans and goals. And the other key piece and strategy that I want to just quickly touch on and sort of share with folks is this intentional partnership and real co-development and co-visioning of strategies with community-based organizations and residents. And one of those strategies that has been used for decades in community, but now there's a formalized funding stream for it through the state, is the development, support, expansion of community resilience hubs or centers. So the Strategic Growth Council, their Community Resilience Center program, will fund new construction or upgrades or retrofits to neighborhood and community identified resilient centers to not just provide shelter and resources during climate and other emergencies, but really support local leadership and grassroots organization and civic and community development initiatives, local workforce development and job training with a specific focus on sort of a green economy and a just transition from fossil fuel industry, distribution of community services and resources. So really thinking of it as like an extension of both the public health and the community health infrastructure that's really guided by priorities of community. So those are just a couple of the strategies I wanted to highlight sort of at the local and regional level that we're seeing, and sort of uplift the Healthy Places Index Extreme Heat Edition as a tool that's being used at the local level to really inform some of these other strategies. So I'm excited to engage in a Q&A and welcome to share more information about anything we talked about. So thank you.
Thank you so much, Savannah. So if our other two speakers could also come back on video, we'll start our panel discussion. And if folks, I don't see any questions in the chat yet, but if folks have questions for the panel, please feel free to drop those in the chat or raise your hand. I'm going to slightly put you guys on the spot because I got inspired as you all were talking. So everybody bear with the fact that I'm putting our speakers on the spot. But one of the things that Chris showed was this really nice diagram of sort of intervenable points within the process of heat leading to heat illness. And I'm going to pull that back up actually, just so that we have it for folks to look at. And I was wondering if the three of you could talk a little bit about how the strategies that you mentioned so far kind of map into this framework. And if there are gaps in terms of the strategies that we talked about, other things that people should be thinking about as they start thinking through policies for California.
Well, I'd be happy to start because this is such a good question, and I love we have like this framework to go with. Where a lot of what I was discussing falls is within heat exposure. And then it seems like if we looked at the planned interventions below that, what to do about heat exposure. So we want to have reductions in heat exposure through whether it's shade, urban greening, use of misters, depending on your climate, also behavior to reduce heat exposure and wearing the right kinds of clothes, hats, and so forth. But then how are we also planning with parents or schools ways that they get the right information in their hands to make informed decisions that hopefully improve health outcomes in kids, but don't make their days too much more stressful or difficult because they're already overworked, and in the end potentially make it an easier thing to deal with. I think that's where we line. And then if we think about the second arrow, biological causal pathways, if we're thinking about children, there are certain conditions in kids we want to worry about. Asthma would be one, obesity would be another one. Aspects that would make a child more at risk to heat, we need to be understanding those. I think sickle cell disease, like how can we make sure that we are aware of what kids are more vulnerable and why to the heat, so that we can intervene a little bit sooner with those children.
The other piece I'd add to those excellent comments, Jenny, is thinking about educating of healthcare professionals.
Mm-hmm.
And frankly, thinking about educating teachers and others so that the people surrounding the child also have that information, so that you can ensure that there is protection, 360 protection around the child, because we unfortunately know that children will complain and perhaps teachers will go, kids always complain, and not take issues as seriously as they should.
Yeah, it's interesting. You almost get kids that like that, or kids that just completely ignore it because they just want to keep playing. So it's almost like a bell curve of what ones, like, you're going to need to worry about both extremes. Like the kids that just don't want to, like, or maybe are really feeling the heat, well, maybe because they're more vulnerable, and then the kids who are less vulnerable, but they make themselves more vulnerable because they just want to play. And that's where I say, like, give them better spaces to play in, even if it's okay, this is the play, like this is the area of the playground we will play in today because we know it's cooler and more shaded than the basketball court, and we can play in the basketball court next week, kind of. So yeah, it's such a range of like what teachers and recess staff are dealing with it. And one of the features of Heat Ready Schools is doing trainings on their professional development day, where they can each year watch a heat training video where they can learn about the signs and symptoms, and that's through the CDC. So we don't have to we have a lot of resources out there already. It's making them available and emphasizing their importance.
Yeah, one piece I thought you were going to add to that is there's resources like the Corey Springer Institute.
Yes, KSI, yeah. Especially if we're working with high schools there, especially, then at that level, we're thinking about interventions for the athletes and youth sports, which is, they're definitely a lot more vulnerable in that space of youth sports for the heat before they get to college sports, because there's such a lack of resources and athletic trainers and sensors and all of that. So the Corey Springer Institute is a fabulous resource for extreme heat exposure in youth athletes.
And if you'd like to hear more about that, actually, our first session had one of the Corey Stringer Institute
Robert, yeah,
speaking. So go back and listen to the recording from session 1 if you want to hear more from him.
yeah.
Savannah, you chip in where your components fit.
Yeah, I was just going to add it, and I think ours very much fit in sort of in terms of what I was talking about into sort of this heat exposure place and really around the planned interventions piece. And I think the only component I would add here is just really thinking about the importance of co-development of any of these interventions with sort of the intended and prioritized sort of community members, and really thinking about sort of as we're designing interventions, how are they going to be used, prioritizing changing and sort of this retrofitting of existing infrastructure that where community already gather in places that are already of priority to community members and residents, to really ensure use of those spaces for this sort of like heat resilience strategy as well. And I think that's a really critical sort of from this equity perspective too, is how is additional investment being made in places that are of priority to community versus the sort of development of maybe new infrastructure and resources, you know, while also critically important, but making sure there's sort of funding allocated for both. And that's, you know, very much the intention of the SGC's Community Resilience Centers program. And we're really, really excited about that. And think that's a critical lens to really bring to any of the interventions we're talking about.
And I'd like to add one more piece is that, of course, as climate continues to change, we're seeing much more extremes. And when you look, for example, the UK has got one of the best heat wave early warning systems in the world. Last summer was a massive heat wave, and the numbers are just being finalized, but I think around 2,000 excess deaths, even with significant preparation. So one thing that is going on at not a high enough level is stress testing, of thinking about the programs that you've talked about and to say, how would they function with temperatures that you've never seen before? Stress testing is becoming more common in other sectors. There's stress testing going on in Canada under some projects with Health Canada. And a few other places are looking at doing this as well, because you do have lots of great suggestions here, but what happens when the temperature is 20 degrees higher than normal? And what do you have to do when you have more an emergency situation where the temperatures are so extremely high, and what extraordinary measures would have to be taken in those situations?
Great, thank you guys so much. That was really helpful. I'm hearing that we know a lot about strategies that have been used and can be used in terms of shading and looking at what community factors exist. I think Chris, you mentioned a couple of really important gaps in terms of things that are happening already, both in California and other places. A real gap in education of health professionals, as well as that gap in stress testing. Any other gaps that you guys can identify in things that you can see could be happening but really aren't happening yet?
I can start the other way around with saying that one of the significant challenges we face is the underinvestment in this area. As a researcher, I know every researcher says there's not enough funding. There's been almost no funding at all in this area, and we're so far behind where we need to be. And so many questions that all of us have. There's been, most of the investment has gone into determining, for example, thresholds for early warning systems. Almost nothing in terms of behavior. one of the challenges for older adults is they become less well able to tell they're getting into trouble with the heat. What messages can we give that would motivate changes? How can we make sure that people take action? And we just frankly don't know. So, long list of what we need to do. I would start with the messaging questions, because few of the messages have been tested. We are seeing many instances of looking at co-design. We think those are going to be better messages that come out, but those need to be tested. We can't afford to test everywhere. We need to start upscaling messages and really understanding how to motivate people to do the kinds of things that need to be done when it's hot. And often people are not aware that they're in trouble, and get people to take action anyway.
I think, Stephanie, one of the things that comes up for me more like down back to the thinking about kids and the impacts is it is tough to do research on kids to get the IRB approval. But we don't have to be looking at like when a kid gets sick, because there's this huge continuum of what's happening in between a healthy child and a child with heat illness. And we miss a lot of that information because we're not necessarily collecting it. So if I'm talking to nurses, oftentimes they're not recording when kids come in with heat illness or leave class to get an ice pack or are dehydrated or asthma exacerbations on heat days. And that kind of information can be really valuable in justifying the need for more resources to keep kids cool in our current or future climate. Again, I don't want to say just keep kids inside, because I don't think that's the answer. And I think humans are smart enough to find ways to make sure kids can play outside for a half hour a day at school. But also then thinking about, so that kind of information, even how much time are kids missing from class because of the heat? We actually don't have that quantified. How much does this affect teachers? We can talk to teachers and get anecdotal evidence that hotter days can be harder to teach on because kids are tired, listless, have poor behavior, but there's still a lack of actual trials looking at that and comparing a control class to a test class, right? And then talking to teachers more, but then it's like, okay, teachers are so busy, we're just adding more to their day. So, you know, it's like we're sometimes stuck between a rock and a hard place trying to work with schools because we often can't fund schools. Like there's restrictions on how the funding can be used, and it would be nice if there were more unrestricted funding available to be able to give to schools for some of these interventions or to do these research studies and to pay for teachers' time, that we really need to get at some of these questions. A lot of the studies actually on heat and learning tend to not be done in the elementary age schools. They're done in high school students taking SAT tests. And why is that? We should be able to do those studies. I'm not an education researcher, but we do need more interdisciplinary collaboration so that we can quantify heat exposure well and quantify what that exposure means to learning and behavior and day-to-day practices at schools.
And one other piece I would add, and this kind of builds on what Chris was saying around the funding piece, and I think this is really cross-cutting across, you know, not just extreme heat, but other climate impacts, and also thinking about sort of broader sort of public health outcomes is thinking about funding for local health jurisdictions to engage in climate-related work and really integrate it into existing programs and functions. And as I mentioned in sort of during my slides, like there is a trend moving in this direction, but there's still very, very limited funding. And as we well know within public health, funding is very siloed and very based on sort of specific programmatic areas, but the real need is to think about climate impacts across the different, so whether it's maternal and child health, or whether it's thinking about CalFresh healthy living and nutrition programs, thinking about sort of the surveillance and epi side of it. So I think that's a big need, is increased funding at the local level to really approach it from a holistic perspective, to think about the data needs, and where can climate-related or extreme heat-related indicators be built into existing public health programs to then inform the strategies that local public health jurisdictions and their partners are already implementing or might need to expand or shift based on the emergent climate-related needs, whether extreme heat or otherwise. And then the one other piece I'll add in there, and this is kind of a slightly different focus, more from the worker perspective, is around, and there is a formal rulemaking process that has been initiated for indoor workers, but there are standards around temperatures for outdoor workers. There are not yet for indoor workers, and this process is now underway within the California Office of Administrative Law, and their intention to do that with OEHHA. But that's a real need too, is looking at the impact on indoor workers as well.
Thanks. We're going to move. We've got questions coming in from the audience, so we'll go to those. I will also note for folks that we have a number of resources that have been dropped into the chat. So, things like the fact sheets that Chris mentioned during her talk, and the report that Jenni mentioned, and Savannah linked to the HPI that she showed. So those are all there. I'll also make sure that when we post our recording that we'll have those links available for folks. All right, so question from Braden K. How can we ensure that nurses, health professionals, and student voices are heard in facilities maintenance and design? Any thoughts on that? How we get that sort of cross-disciplinary bridge building improved?
There's all kinds of fact sheets that people can put together, guidance documents, all comes back to the question around funding, but there's lots of ways to do that kind of outreach. And the more that outreach is done, of course, the more it builds on itself and becomes more effective. And what I've seen is that it often just takes one champion to get it started. We did that here at the University of Washington. Jenni did it as well at ASU. And boy, once you start doing some reaching out, you have lots of opportunities to work with people who are undergoing training, thinking about people who have short courses during the summer of trying to get information in. And then, of course, what you're doing very effectively is sending links to, for example, NIHIS and the programs that they're putting out, so that people have lots of opportunities to gain the information, along with people to reach out to ask questions when they have them.
Yeah, Stephanie, he said nurses, maintenance workers, and who else? Like teachers?
Nurses, health professionals, and student voices. But you're absolutely right that facilities professionals at schools are also really important.
Yeah, Chris, thanks for the question, Braden. I'm trying to think from the school level and working with different schools and seeing how it works, from a charter school perspective or a public school district perspective. It's really different. So you do have to go down to the school level sometimes and then figure out who's the actual right level to work with. So sometimes we're working with the school district. So we're working with the Tempe school district, but with charter schools, we're working directly in the school. And then from there, we start to think about messaging within those realms. I think that Chris brought up the notion of champion, and within the Heat Ready program, each school decides who's the Heat Ready champion. That could be a student club, a librarian, a nurse, a teacher, the principal, and then that person drives things with our help. And so we don't want to prescribe who does what, but that's the bridge builder at the school. So how can we make sure they have the resources and knowledge to build those bridges? So when there is a tree planting, is the nurse outside for the tree planting to learn what the maintenance workers are going to have to do to keep that tree alive, that's going to keep those kids cooler in the future. Having community events where everyone comes outside and learns how to do things, including the parents, can be so valuable to making sure there's this cross-cutting knowledge exchange and everyone understands that they're all on the same mission at the school level. I think a lot of that is really helpful. Hard to quantify what makes a big impact versus what doesn't, but when you start doing enough and you start doing it together, you're going to see the impact there.
If I could add two things to that. One is California is one of 4 states right now that has regulations around outdoor workers. And so that's a real opportunity to make sure everybody's aware of that and make sure everybody's aware of the regulations. And second, Jenny, on your last comment, there's at least one publication from Jan Semenza when he was in Oregon and did some projects to build social capital. And it was looking at the roundabouts that they've got all over Portland and getting the neighborhood together to plant a bunch of things in these roundabouts and become a community project. And so he published about the effectiveness of these in terms of increasing the social capital and how he's got photographs of how beautiful these things are, how well maintained they are. And there's other literature like that of thinking of how we can use these opportunities to focus on heat, but also more broadly build that social capital. It's going to be important going forward.
So Priyanka Fernandez asked whether there's any evidence to show that humans might be able to adapt physiologically to higher temperatures. And I will just add that I'm not sure, Priyanka, if you were talking about sort of long-term adaptations or shorter term. Shorter term wise, in that first session on pediatrics, Robert Huggins from Corey Stringer did a really nice job talking about acclimatization and sort of how that changes with early football practices at the start of the season and so forth. So I won't pump that piece to this panel, but I'll ask you guys, A, if you have thoughts about sort of, long-term adaptations, but B, how that idea of acclimatization could affect the strategies that folks use.
Jenny, did you want to start?
Yes, I can start. And thinking about that, it depends on the person you're talking to and the age of person you're working with. So we think about so we're talking about acclimatization. So it's the physiological adaptation. And we physiologically adapt to heat each summer. All of us do. And then the more we are exposed to heat, especially in an exercising state, and I'm sure Robert Huggins would have talked about this too, the better we can then cope with it in the future. And this is what athletes do when they have a big competition coming up. So we have blood flow changes and our heart rate has to pump less for each, or can pump more blood for each pump. And we have sweat rate changes. All of those adaptations can strengthen our ability to withstand heat in the future. But there is a limit. Even the top athlete cannot overexpose themselves to heat without seeing potentially detrimental effects on themselves. So with that being said, we have to think about that. We can't just assume we're going to always be able to adapt to heat, and understand that at the start of the season, we're going to be less able to handle the heat than at the end of the heat season. However, we know that when football practices start in August, that's the middle of the heat season, but we still see that's when there's the highest rates of illnesses in football players. So we have to also account for what their individual exposures have been over the summer, and they have to be given that 2 weeks to acclimatize to the heat as well. So that's thinking physiologically in terms of heat adaptation. And then Chris brought up behavior. And there's so many behavioral adaptations that you see more common in hot climates than cold climates too. And so those kind of go under the radar in terms of how people are behaving in the heat, and we can do a lot more to improve our behavior, and that might involve better education as well for the public. And then of course, when we think about other adaptation strategies, we have infrastructure and we have technologies that are going to keep helping society adapt, but physiologically there is a limit to what we can do. I hope that answered the question. And kids are not going to have the same ability to physiologically adapt as adults either.
Yeah, Jenny, I'd like to underscore one of your comments and add another one, is that in much of what we see in the health literature, it focuses on that physiological adaptation and doesn't really think about our infrastructure and think about what we need to do in the red line districts, what we need to do in so many locations in terms of our infrastructure. And this is why heat action plans are so important, because they look at the longer term. Seattle is a city of cranes. I drove down there last night and didn't recognize a whole bunch of buildings that went up while I wasn't paying any attention. and making sure that we interact with the people who are doing that kind of planning and make sure that they think about what infrastructure needs to be resilient for 50 years from now. The second, on the physiological adaptation, there's one fascinating study where researchers took advantage of a natural experiment. At the end of World War II, there was significant migration from southern Italy to northern Italy because that's where the jobs were. And researchers took advantage of that and did a study looking at heat-related mortality in the northern part of Italy, comparing people born in the south from people born in the north, and showed that even after people had lived in the northern part of Italy for most of their working lives, they still were more resilient to the heat, presumably because they were born in the south, than people who were born and continue to live in the north. And so, yes, on the physiological adaptation over time, we know that humans can do that. And thinking perhaps more nuanced about there may be limits based on our genetics, based on, frankly, probably from the mitochondrial DNA, and thinking about then how that needs to be taken into consideration. I live in the Pacific Northwest. We have much cooler temperatures than you do. Boy, I know people here who can hardly wait to get to the Southeast because they love the heat and the humidity. It's like, glad somebody wants to go there, and I'm glad it doesn't have to be me, right? I mean, we all like different kinds of climates, and how do we help personalize? At the same time, we have the generic messages that we need to get out.
You guys talk a little bit more about, one of the things that I think is really cool and fascinating about California is we really do have a lot of different climatic zones. I live in the Bay Area, and my husband used to joke that on his hour commute, he went through 5 climate zones. He'd be on BART and people would get in with like winter coats and parkas, and then the next stop, it would be like tank tops. I think that consideration of the different climatic zones, and I think somebody mentioned humidity briefly earlier. Could you guys talk a little bit more about tailoring strategies to different areas?
Yeah. Do you want to go, Chris or Savannah?
Go ahead and start, Jenny.
Yeah, so from living in California and living in San Diego, I got to kind of experience that too, like going down to the ocean and the marine layer, and then up higher, it was like sunny and hot. And as you go coastal, you're going to hit mountains, you're going to hit desert. You have a lot of different climate zones in California, and that is really important to account for. Similarly, in Arizona, you go from Tucson to Phoenix to Flagstaff. And what we've done for the work with Arizona Department of Health is break it into 3 zones that would have different thresholds for activation of heat interventions at schools, so that Flagstaff is going to have lower thresholds than Phoenix and Maricopa County would, for example. So that's one way to think about it. And then considerations of things like cloud cover, but humidity plays a really big role in some of the interventions. So a more humid environment, you're not going to really want to use something like misters because that's just going to increase the humidity, but you can really focus on things like airflow, and even fans make a really big difference if you're working in a humid environment versus a dry environment. And then in that dry environment, you really want to focus on cooling. Misting does really work. Wetting the skin works. If you look at the handout Chris shared, that's where wetting the skin works to help with that evaporative cooling if your body is not sweating as much as it wants to be because you have a limit to sweating. Shading then too in the dry, clear climates, but it is very much so. We worked on that with the Canadian document. Depending on the climate zone you're in, there's going to be different strategies to reduce heat, or you may have a really big focus on improving thermal comfort in the winter based on, and with that it's wind. And so, yeah, those considerations are super important, and California is going to see all of that at some location throughout the year. And so you can make, we call it kind of like bioclimatic specific design strategies for that climate zone.
And then a piece I would add in there, sort of nested within this like bioclimatic zone, Jenni, that you were just talking about, is also thinking about culturally like appropriate and relevant strategies and interventions as we're thinking about this. So not just the difference in sort of like the environmental and kind of the external, but also really looking at the nuance and like appropriate messaging, intervention, and strategies for different neighborhoods and communities. And I know we've all kind of touched on this in different capacities. And I actually want to bring a thread that Mark shared in the chat that really ties into this, is thinking about partnership and working with community health workers or promotoras in sharing really in this like bi-directional way of both hearing about the specific needs and priorities of communities, especially those that might be linguistically isolated or more rural communities that have very different needs and access to very different resources, and bringing that again to whether it's local agencies or academic institutions, other folks that are operating to help shape strategies and interventions, and then being able to sort of be that in between and really help tailor both the messaging and the strategies. So that's just another piece that I would add into sort of your question and comment, Stephanie, around how to think about the different approaches and strategies to ensure that they're culturally appropriate and ultimately sort of used and adopted by folks.
Great, thanks. I think that's a really great point as well. And certainly, we have plenty of difficult to reach populations in California, and making sure that we're, serving all of those people is really, really important. We got another question actually from Mark in the chat earlier, which is the question about the choice between man-made shade structures versus living shade structures. Could folks talk a little bit about sort of the costs and benefits of those different things?
I'm happy to start with that one. I guess the location you live might matter a lot here. You see a lot of shade structures used around the Phoenix area. One of the reasons for that is because trees are harder to grow. We live in a desert, and there's going to be some areas of California like that too, in the valley, California Valley, where trees are harder to grow. And they require water. And if you also want shade right away, then a shade structure will provide that. In working with cities like City of Tempe, we've been able to talk with their parks department and find ways that we can incorporate trees into the playgrounds that would help shade that low-lying sun angle shade, while also incorporating, shade sails they already have there, that's shading the playground, especially at the hottest times of the day. So sometimes it's really nice to bring trees and shade sails together hand in hand. They are expensive, but one of the things we find with how playgrounds are kind of thought out and designed is that shade tends to come last, unfortunately, which means the budget might run out. So how can we prioritize shade sooner so that the budget isn't going to run out before we get the shade sail purchased? And yes, shade sails are expensive. There's a lot of companies that will work with schools or communities to provide decreased costs for shade sails. I will put a couple of links in the chat of shade programs throughout the USA that schools can apply to and communities can apply to get shade structures up. And yeah, just thinking about how can you work with urban foresters and then the maintenance staff to select the right trees, to maintain it well, to give it the right amount of water and so forth, so that you are designing with the climate in mind and understanding that here we're going to plant drought tolerant trees, whereas we don't need to worry about that as much in certain locations of the country. Hopefully that helps. I don't have all the cost benefit analysis of that done, but sometimes it depends what money is available now and what you want now. So shade can come now if you put in a shade structure and you have a lot of money to spend on that, whereas trees are going to take a while to grow, but eventually they will provide not just shade, but evapotranspiration for cooling the air, and then other co-benefits to people that we know that nature spaces have, especially in urban areas.
Thank you so much, Jenni. We are almost out of time, so I'm going to ask you guys to each, if you just have like one final thought that you would like to leave our listeners with. I will go to each of you to do that, and then I'll wrap up. I'll put back up the link, so if people want to be able to go to the page, keep an eye out for the registration information for the next session. You'll be able to do that. So Kristie, any last thoughts or takeaway points?
First of all, this is really excellent. Second of all, to add to Jenni, you need to make sure that when you plant trees, they're trees that are going to be resilient in a changing climate. And so tree choice is important. And there's lots of options that one can select from. And she's right that trees are important in and of their own right in terms of our mental health and well-being. And so there's lots of reasons to figure out ways to have trees. And as Jenni showed, engaging school children and helping take care of the trees during the school year, figuring out what to do during the summer, but lots of ways to increase social capital through your tree planting programs. And thank you for inviting me. This is great.
Thanks for being here, Jenni.
I feel like I've said a lot. I don't know. It's a one takeaway. I think it's really important to like work with people. And I think that came across with all three talks. We don't know the solutions for one person or one community or one school versus the other. And by working with them, talking with them, building trust, we can be more confident that anything we do with them or funding resources we might get with them will be effective because they were part of that process. And so we had, we can include kids in the design process and ask them what they like, and same with the teachers and parents. And then we can be more confident that those design changes will be well accepted and well taken care of in the future, no matter what they might be, because the community they're invested in it.
Jenni, you took mine, but I was
sorry. Well, then we can give it a
yeah, just thumbs up to both everything that Chris and Jenni have said, and just co-design and co-ownership with priority communities when we're thinking about interventions and strategies across the board, and sharing funding and sharing resources in that process would be my final 2 cents.
Thank you all so much. This has been so wonderful. I'm putting back up the information for folks. As I said, the videos from sessions 1 and 2 are already up there. We'll have the recording from this session up soon as well. And then as soon as we have it, the registration for the information for the warning system session, which will be later in the summer. Thank you all so much. Thank you to our speakers. This was a wonderful, really robust discussion. I super appreciate it. And so glad that so many folks were able to attend as well. Everybody have a really nice day.